morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning. It is Thursday, September 3rd.
It is.
Week 25.
Yes.
Still.
Good.
See?
Very good. You got both of those right.
Look, go me. Thanks. Okay.
2 for 2.
2 for 2. Here we go.
Yeah.
All right.
Yeah.
Welcome, everybody. We're glad that you're with us. It is our local information program about COVID-19, and today we have a big show, as Ed Sullivan used to say.
Oh, nice.
Dating myself.
Ooh.
Yeah. Right.
Yeah. Wow.
Wow. But the show's in
Tell us
color.
about the Beatles
Not
playing.
like Ed Sullivan.
Yeah,
Our show is in color.
Yeah.
So
Technicolor.
There you go. That's right. We have 3 great guests lined up to talk to us today. We're going to be talking about child care in our state, which I know is a concern for a lot of parents, a lot of families. We're going to talk about convalescent plasma, which I know is a big topic that you're interested in.
Love it.
Right?
Favorite image of 2020.
Exactly. And we're going to talk about infection control. Right?
Also a passion of mine.
This year.
Yeah.
How to keep your surroundings clean, what they're doing at the hospital, all that stuff. So
Good.
that's what we're doing today. How about that?
That's very helpful.
Right? Lots of stuff going on. So
right.
We'll start like we start every week by talking about testing and numbers. I want to just remind everybody there is tests this afternoon, evening here at San Juan College, 6 to 7 p.m. And again tomorrow in the morning here at San Juan College from 7 to 8 a.m. from the Department of Health. So that is going on.
Very good.
Exactly. And again, the Department of Health has their number for how to register and, of course, how to get here and get through it fairly quickly if you register ahead of time, is what I'm trying to say.
Very good.
There's that.
It's super helpful.
In a roundabout way.
Yes.
But yes. So there you go.
It's quick and easy.
Yes.
And so pre-register.
Exactly. I believe we have maybe our first guest on the phone.
Yeah.
So let's do that and get them on the air. Good morning. You're on KSJE. Thank you for calling in this morning.
Oh, thank you. It's great to be here, Scott.
Thank you. This is Sandra Houston from the Regional Education Cooperative in New Mexico, correct?
That's correct. And I'm so pleased with all the interfacing that you guys are doing within the Four Corners area in concern with COVID. And so anyways, what I would like to share this morning is if people are looking for child care, the Department of Education, New Mexico, with New Mexico Regional Education Cooperative Association, has put out a flyer. We've been working really hard to be able to help families and districts to find child care during this time. Everyone is rushing around searching child care possibilities due to the fact that we have now this school reentry. And so if you look up, you can see that we have this access flyer on how to find child care. And you can do it just by looking at your county zip. You can search through the districts, and these links are live for people so they can just access them quickly. And what I like about this is that our governor is really making a point of pulling communities together so that we can help families continue to be safe and find child care. So I'm working through REC1 with David Bowman. That's our regional coordinator for our educational cooperative. So you can also see where you can go on that website, and it's a fabulous website, which I'd like everybody to take a look at. And I know that we're having this on your Facebook page, which is great. So I'm just pleased with all of the interfacing that's going on with community.
Great.
And
well, thank you, Sandra.
And basically, that's it.
For our radio audience, though, I do want you to give us the website, if you wouldn't mind, please, so our radio listeners can also know where we're sending them, right?
Yes, and that would be NMREC1.
Okay. That's what we're talking about.
So they can go to that web page. And also, if they would like to go to our broad website, they can, of course, go to our NMRECA website, and that would be for the Child Care Project.
Very good.
And there are more child care resources and referral support line. They can call into 1-800-691-9067 for direct help and resources.
Excellent.
And so
Sandra, I'm also showing this address too, and I want to just make sure that this is also another website that folks can use, this newmexicokids.org.
Yes, I was just going to mention that, and that is a great tool and resource. It also will give information on possibilities for, nutrition and COVID safety. It's just fabulous, and our state's doing a wonderful job. And I also just want to thank you so much for really pulling our community together in the Four Corners region. You guys are doing a great job.
Well, thank you.
Yeah. So I do have a question about eligibility information for childcare. Who is eligible? How do I know if I'm eligible?
Okay. So what we have here also on this flyer is possibilities for how to be eligible to actually create a little daycare center out of your home, which is very powerful right now because we are seeing child care provider shortages. On our website, it also will give you information on how to become a child care provider and how to get certified. The state is really working hard on that. And so they can go to visit, am I eligible? All right. There's also grants out there, and so when you go to our website, you'll find those as well. I'm glad you asked that question.
Very good. Thank you. And Sandra, again, this is you work specifically in our region of the state with the REC. Is that correct?
I am specifically working in the Four Corners region, and that is in collaboration with the NMRECs, and that means all of the New Mexico Regional Education Cooperatives. We're a collaborative, and we're working, of course, through New Mexico Public Education, and they're the ones that are pulling together all of these flyers and getting it out to the whole state. I believe there's 12 of us now working in the different regions. It's very powerful. We've been collecting data to figure out where the shortages are. We've been also trying to figure out how we can expand child care. That's our biggest challenge right now. So we're looking at how we can expand broadband, power for the technology, how we can work with districts to find local agencies that might be willing to even set up child care facilities. I know that Farmington has been very strong in this with Maria Rodman from the Boys and Girls Club. She's our exec. I've also been working with your chamber, working with Jamie Church, who's also getting that need out to the community. It is all about braiding community resources and working together. And that's what can happen in life-challenging situations. What we see is Farmington's doing a great job, as is the whole Four Corners region.
Great.
So thank you.
Well, thank you very much. And just one more quick question before we go. And I know, schools are planning to do some face-to-face reopenings next week. And so as that happens and kids maybe go back to school for certain days of the week and maybe mom and dad are coming back to work, and this has kind of sparked our whole conversation about, gosh, we need to have you on the show now before Labor Day to talk a little bit about these child care options and opportunities for folks. And so timing is kind of the essence here, right?
Timing is of the essence. And what we're calling a lot of this re-entry into the school districts, it's called a hybrid. Some students are opting to work solely out of home, long distance learning. Others are coming into school with a modified schedule. So our superintendents, I also want to give them a bravo and hats off because they're working very hard to make families feel safe. And they're working very hard with our public education department, New Mexico Public Education Department, to make this all happen. And even their staff, of course, coming in as they are to work directly through the schools, are needing child care for their children as well. So we're all just pulling together, and basically it's not can we do this, it's how can we all pull together creatively, and that is happening in your community and the whole Four Corners region, of course, and the whole state.
Very good. Thank you so much, Sandra, for coming on. We really appreciate it.
Thank you. Well, we appreciate you, and you have a great day.
All right. Thank you. You too. That's Sandra Houston from the Regional Education Council for Northwest New Mexico, speaking with us this morning on our COVID-19 local information program. Good information. We
Great
appreciate that. I
information.
know a lot of folks are talking about the need for childcare, or how to find it, how to pay for it,
Yeah,
what's available,
It's been a constant stressor.
all that stuff.
Yeah.
So exactly. So there you go. So we appreciate her coming on and talking with us this morning. We were going to talk a little bit about numbers as well as we get going on this Thursday. So Johns Hopkins, I know
That's right.
you watch them every day.
I do. I'm a fan.
You are a Johns Hopkins fan.
Go Blue Jays, I think.
Is that what they
actually
are?
have a mascot.
Okay.
They have a basketball team?
Maybe.
I don't know.
Sure.
Probably not playing right now.
Probably not.
So, anyway.
But when they do, the Blue Jays will be.
Go Blue Jays.
Yeah.
Okay.
Feel the
so-
sting. No, that's not right.
What?
Feel the sting. That's Scorpions.
Yeah.
Okay. The Blue Jays don't sting.
Don't have stingers?
No, of
okay.
course they don't.
Anyway, all right, so numbers. So the U.S. confirmed numbers are 5,997,861 confirmed cases. The U.S. confirmed deaths are 183,068.
My numbers are a little higher than yours
Really?
today. Have you refreshed your
I
number
think
there?
so.
Because we're at 6.1 million cases.
Well, that's weird because I did just refresh it. Huh.
That is
interesting.
weird. Interesting.
Okay.
All right.
Well, should we
With it, we're
take
in the ballpark, I
let's
guess.
take the median
Okay.
number, maybe?
Right.
Okay.
About 6 million cases. Yeah. So there you go. But 185,000 deaths, according to our website graphic from Johns Hopkins.
Weird.
Right. Very weird. But the other thing I like to show on this graphic is this kind of graph on the lower right-hand part of the screen for our visual radio listeners and viewers to see kind of the daily cases in the United States, and we can see kind of that the trend again is heading down, which is a good thing. And we've talked a little bit about that. That's what we want. So that's important. All right. Let's
Yes.
move on and talk about our state.
Sure.
And see where we are here. In New Mexico, as of yesterday, again, these are the daily numbers, so they change every day. 154 cases in New Mexico yesterday. In San Juan County, we had 5 new cases. So San Juan County now has had almost 3,200 cases of COVID-19. There were 3 deaths in New Mexico yesterday. One of those was in San Juan County, and that was a lady in her hundreds.
Aw.
Yeah, with underlying health conditions. But yeah, that was
but-
noted.
That is, well, it's notable anytime somebody survives that long.
Right.
I mean,
True.
wow.
But that was that one death in our county yesterday. And then we had 107 more recoveries in our state yesterday for a total of 13,180 recoveries in New Mexico. And then I want to show the other news stories, again, from KSJE.com, where we are kind of compiling the numbers every day. There's the Navajo Nation numbers, of course. They had 17 new cases reported yesterday, 1 additional death now, so there's a total of 9,847 cases on the Navajo Nation, 504 deaths. But again, these numbers have been low now for quite a while on the reservation. They've done an amazing job of getting these numbers down, so congratulations to them. Those are the New Mexico statistics next to that. And then the other story that we want to draw your attention to is CARES Act grants have been released to local governments and businesses. So what that means is the state has taken its CARES Act money, and given some of that in the form of grants to local governments to reimburse them for some of their expenses they've had to make during the pandemic and the shutdowns and things like that. So the city, the county is getting reimbursement funds from the state, so that should help with their budgets. But then also, as part of this, they were given money to then have businesses apply for grants, not loans, but grants, to be able to pay for some of their coronavirus expenses too. So
Right.
local businesses, I think, are being encouraged to apply to their local city, county, to apply for this money.
Great.
Because that's what it's there for. So there you go.
Yeah, it'd be a shame not to take advantage of that.
Exactly. So all that information's on our website, again, ksje.com. That was announced just earlier this week. So we certainly hope folks will take advantage. I believe our second guest is ready to go.
Wonderful.
So let's go to the phones. Good morning. You're on KSJE. Thanks for calling in this morning.
Good morning, Scott and Megan. This is Tim Meir calling from BPL Plasma, Oregon.
Hey, Tim. We're good. Thank you for calling in. We appreciate it. We haven't spoken to you in a little while. So, of course, the last time and the times that you've called in, we've asked you a little bit about the convalescent plasma collections that BPL is doing. And so that is still happening, correct?
Yes, it is. And I'm happy to say that we have been successful in our efforts in collecting convalescent plasma in the San Juan region, which is a very exciting thing that we can contribute to this possible therapy. Hopefully we can contribute also to the ending of this whole pandemic that we're living in right now.
Exactly. And so, Tim, talk to us a little bit about what BPL has been doing. You mentioned, of course, the collections here in San Juan County, and of course, we keep hearing about this convalescent plasma being used as a treatment in some cases of COVID-19, and that's kind of what BPL has been doing, is providing some of this for these types of treatments. Correct?
Well, the term convalescent plasma simply means that it's a plasma that has been collected from recovered patients. What you're hearing in the news right now is generally referring to convalescent plasma used for direct infusion into people with serious COVID-19 complications. That's not how the plasma we collect in BPL is being used. We are collecting convalescent plasma for further manufacturing into what we call a hyperimmune globulin. The short form of that name is HIG, which is a concentrated specific therapeutic medicine manufactured from pools of plasma from hundreds of recovered patients. And there are key differences to the convalescent plasma transfusion, and there's a difference between that and the hyperimmune globulin that we're currently collecting plasma to manufacture. So if you allow me to kind of run through some of those, just to clear up the confusion that we hear in the news about convalescent plasma as an umbrella term for all plasma collections from COVID-19 recovered patients.
Yes, please do.
And so with that, for a definition, convalescent plasma transfusion is actually plasma that is being taken directly from one recovered patient and transfused into a patient with COVID-19 that has serious complications. Now, we need to know that plasma is 90% water. And when you're taking a unit, let's say a liter, and you're injecting it into a person, you're injecting 90% water. And within that unit, there's a varying grades or levels of antibodies, which affects the potency of the convalescent plasma that is being given to the patient. On our side of things, when we're taking that plasma to manufacture into a hyperimmune globulin, the potency is guaranteed. So we have a minimum level of antibodies that can treat the patient, versus it's more of a gamble with direct convalescent plasma transfusion, because we don't know. Between each donor and the other, there's a varying levels of antibodies. With us, what we're trying to create is a therapy with a concentrated level of antibodies that guarantees the maximum effect, so we can treat the patient and get them to recovery as soon as we can. For convalescent plasma transfusion, it is individualized therapy, which means each unit treats one patient. For us, it's a mass-produced therapy because we're pulling from donors and we're sending it to manufacturing facilities. It's pulled together, processed to remove or inactivate viruses and toxins, and then purified to concentrate those antibodies. And also, it has a long-term use because it requires more processing And also with that comes more clinical trials. It will take longer for HIG to be available, but the shelf life for it is 2 to 3 years, and it's mass produced. So that is a key difference that helps in addressing the pandemic on a larger scale.
Right, very much
The
so.
potency also, yeah, and the potency is really, it's a very important factor when we're talking about convalescent plasma. It is great for everyone to go and donate convalescent plasma in any capacity they can, wherever they can find a donation center, whether it's for direct transfusion or for further manufacturing. But what we do at BPL Plasma differs greatly from what you're hearing in the news or, the general term of convalescent plasma transfusion. And again, you're seeing more of, celebrity kind of engagement with that. That is absolutely different from what we do here at BPL Plasma.
Great. And so, say I'm an individual that, maybe I did not have COVID-19 or I'm unaware if I harbor antibodies, et cetera. We still need plasma donors, period, right? Even if you haven't come into contact with the disease.
More than ever, with the pandemic now going into the 7th month, I guess, if we want to calculate since March, what is happening is that our patients that with immunodeficiency diseases, they've been suffering from the shortage of plasma-derived therapies, because with the lockdowns and the inability to move, donations went down. So the supply of raw plasma, that again, if you can imagine, it's 90% water. So what we take from each donation to manufacture medication or therapy for one donor takes a huge number of donations. Sometimes it takes 1,200 donations to manufacture a therapy course for one patient that lasts them 1 year. So think about it. There's hundreds of thousands of patients, and with that, we need more donations than ever because of the shortage that we have right now to compensate for the losses that we've had in the past 6-7 months.
Great. That makes so much sense. Well, Tim,
Interesting. Yeah.
Tim here, thanks so much for coming on and especially explaining that difference between what we're hearing in the news and what's going on with you guys. Thanks so much for all the fascinating information you brought us this morning.
Well, thank you guys very much. And again, we thank you for supporting, plasma donation in general, and we wish that everybody would come in and donate. It's a great cause, and we wish everyone would come in and not only donate plasma for the good of it, but also we provide that, compensation fee for their time. So if there's anything that we can help with filling a little bit of the financial loss that they have, this is a great cause to do it while spending time in the center donating plasma, helping others. So thank you guys very much for supporting us in that mission.
You bet, Tim. Thank you again for the update, and we'll talk again soon. Thanks very much. That is Tim Muir from BPL Plasma. We appreciate that.
We do.
Our next guest is ready to go, I think. But, of course, you were not around. I was looking for you.
I know.
You were on assignment again.
I was on assignment at the lake.
Well, must be nice, but good for you. Anyway, some of us who are still working talked to Penny Hill from Salmon Regional Medical Center.
Right.
Yeah.
So let's hear her.
Joining me this morning to talk a little bit about how to stay safe during the cold and flu season and also the coronavirus season. Penny Hill is joining me on the phone from Salmon Regional Medical Center. She is the infection control manager at the hospital. Penny Hill, good morning.
Good morning, Scott. Good morning, everyone. Hope this finds everyone well.
Right, exactly. And that means a lot this year for sure. And so it's good to have you on with us because, well, I have to admit, Penny Hill, you and I have known each other for a long time. And I think you get to say, Scott, I told you so. Because I can remember decades ago when you would tell me how to wash my hands and use a paper towel to open the door to the bathroom and do all these different things that we're now doing. I'm doing it more and more every day, and I keep thinking of you when I do these things.
Right. Well, that's a good thing.
Yes.
That's a good thing. Yeah, it is a good thing. So my message was good, and now more than ever, all of those ways to keep safe are so important, and we've all learned a lot, I think, over these last 6 months.
Very true, very true. But let's talk about that. And so, again, your job is as infection control manager there at the hospital is to kind of keep everybody aware of proper hygiene and what they should be doing and all the other things, nooks and crannies at the hospital. Tell us about your job a little bit.
That's right. My job's been very challenging this year, and because the focus is on staff members, physicians, everyone wearing the right personal protective equipment so that they stay safe while caring for these very, very ill patients, and that we don't spread any of the COVID from patient to patient. So in general, that's my job, keeping employees safe and keeping patients safe while they're at the hospital. So this has been a big learning curve for all of us, and I think we've done really well, and continue to change and update and get new guidelines out to staff. So it's been very challenging, but I think we've done really well. We have an awesome team here at San Juan Regional in our incident command team, and just everybody's done an excellent job.
Right. And even in the days pre-COVID-19, pre-coronavirus, I mean, you still had a lot on your plate too, right? Keeping the hospital and keeping all the staff, as you mentioned, kind of safe, even when there wasn't a big infectious pandemic running around.
Definitely. This is just icing on that cake, so that's what we'll call it.
Very true. And so let me get back to what I mentioned a little bit before, Penny Hill, because you know, we've been talking, as I mentioned, for a long time about the work that you do, and I know for you it's probably second nature, but for the rest of us, you know, some of these things that are now hopefully second nature we're still kind of new back in March, like making sure we weren't touching our face and washing our hands more frequently and doing all these things that you've been preaching for years.
Finally, everyone's listening, maybe.
Right, I know.
Well, and it's just the way that germs are passed person to person, you know, and we know how to prevent that, and we just need to do those basic things that, you know, our parents or our grandparents taught us years ago, is to, you know, wash your hands frequently, especially when you're in public places. But now it's taken on a new level with COVID, in wearing masks and not touching surfaces in public, and it's taken on a whole new meaning. But I think it's those basic infection control, prevention, and strategies are definitely in place, but everyone's more cognizant of them these days, which is a good thing, I think.
Right. No, I agree. Definitely, it is a good thing. And so when we talk a little bit about doing these things and helping to do these things, and let me transition a little bit into the maybe cold and flu season that's just ahead of us. Are you hopeful, fingers crossed, that we have maybe a milder cold and flu season because all of us are now so used to washing our hands and not touching our face and wearing our masks? Could that help maybe have a milder cold and flu season this winter?
I think it might. You know, the flu is spread by close contact with others, so wearing a mask in public and washing your hands, you know, may have an impact on the flu season as well. I think we really don't know how that's going to play out as states open up and we have indoor dining and school opening up, and I think it's a little early to know.
Sure.
But I think that those basic principles of wearing a mask in public, that will prevent flu from being spread as well. Washing your hands, not going to work when you're sick, not going out in public when you're sick. All of those things are going to help to mitigate, I think, the flu spread this year. I'm hoping that everybody really considers getting their flu shots, because that's the main way that we're going to have immunity and prevent the spread, in addition to all of these other things that we're doing, like the masks and hand washing and staying home when you're sick. So all of that will help.
Right. And I know, I think the hospital and others are about to announce maybe some of the schedules for flu vaccines and things like that in the next few weeks to let folks know when they can get their flu shots. But that's been an important message, I think, every season, of course, to make sure folks get their flu vaccine. And so with this plus the coronavirus, I guess if we're not careful, we could see an overwhelming of our hospitals again with sick patients, whether it's flu or COVID or both or what have you. And that's what we don't want to happen, right? We've tried to avoid that all summer.
Right. That is exactly right. The healthcare systems have already been overwhelmed with COVID, and certainly if we had a surge of influenza patients this fall, that would certainly add to that current strain. So it's more important than ever to get your flu shot. The symptoms are really similar to COVID, but preventing the flu will definitely save lives and preserve those precious healthcare resources. And we really don't know how deadly COVID and influenza will be together, but my guess is it will be just that. It will be very deadly together. If a large portion of our community is vaccinated against the flu, it may decrease hospitalizations and death from one of these two deadly diseases. So I think we just have to not forget that tens of thousands of people die each year from influenza, and hundreds of thousands are hospitalized each year. So if you can have any effect on that by taking your flu shot, I think that's the big important message this year.
Right. And I would say, too, I know a lot of folks say that. They say, well, a lot of people die from the flu every year, and you know, what do you say to that? And that's with a vaccine. I mean, that's my point, is this can still be very deadly for folks and affect their health even with a flu vaccine, whereas with COVID, we don't have a vaccine just yet.
Right, that's true, and we don't really know what that's going to look like. The COVID vaccine. I know that we've been working with the New Mexico Department of Health, and they've been working with communities about COVID vaccine planning at this time. It looks like it's going to be 2 vaccines initially, spaced apart, by a month or so, similar to when other vaccines are given for the first time. Measles, mumps, rubella, or chickenpox vaccine, you have to have more than one. The first one sort of starts that immune response, and then the second one really gets it going. So I think more to come on that.
Sure.
We don't really know exactly what that's looking like, but we are starting to work with the Department of Health and locally and at the state level to see what we can do about that. But back to flu vaccine, we really want to make sure that everybody gets a flu vaccine this year especially. It's recommended for everyone 6 months of age or older, and we've seen even some states requiring this for all school-age children and college students to get their flu shots.
Gotcha.
So I think that's a good thing.
Right. And I know, Penny Hill, I think you would agree with me, if anyone had a specific concern about the flu shot, I mean, if they ask their primary care physician, I mean, they should be able to explain how a flu shot works and hopefully try to calm any fears that anyone might have about getting a flu vaccine because of all the benefits that it does provide to individuals and their families. If you've got elderly folks living in your household, that's an at-risk population.
That's exactly right, Scott. So the CDC tells us that hundreds of millions of Americans have safely received the flu shot over the last 50 years. I know that sometimes I have a little bit of a sore arm. I think a couple of times over the last, I don't know how long I've been getting the flu shot, 25 years or more. I've had some mild body aches and a headache maybe the evening after my flu shot, but those are normal side effects for the flu vaccine. It really just means that your immune system is working and responding to it, and so you should expect that. I know I went to my doctor and got the 2 shingles vaccines, and that's exactly what he told me. He said, so you're going to be kind of achy the first day. A lot of people have had that, but it just means that your immune system is responding, and it's not going to be anything that's going to land you in the hospital. It'll actually keep you out of the hospital. So keep that in mind.
Right. Very true. And I think these days, and correct me if I'm wrong or if you feel differently, that people are a lot more aware of their health because of what's been going on, and if you get the sniffles or a cough, you're kind of concerned about what that might be. And so I think folks are taking a lot more interest in their health, maybe a lot more active in staying healthy and making sure that they are doing all the things that you have just advised us to do with washing our hands. And so hopefully if they hadn't gotten the flu shot in the last couple of years, this year might be the year to change that.
I'm hoping so. I really hope that everyone considers it, especially this year. I think nobody needs that on top of the potential for COVID in your household. We've seen how easily COVID can spread person to person in your household. Well, flu does the same thing. It can spread person to person, and some of your higher risk family members, like you're talking about the elderly or even new infants,
right,
could end up in the hospital and very, very, very ill, or even pass away because of their infection with influenza. So all of that's important. I think this year we've learned how it's spread, and we've learned how to prevent it from spreading. So I think we need to apply all of those same rules to influenza and get really good at preventing the spread of the flu.
Right. I definitely agree with you. And again, those vaccines will be available soon. I know some folks in some clinics have already gotten their supplies in. They're maybe planning to roll them out maybe October 1st, I think is the recommendation from the CDC. But we'll see what other folks are doing.
Right. The really recommendation is get it as soon as it's available.
Right.
I think definitely by the end of October. I'm seeing flu vaccine flyers from retail pharmacies already available in the community. So consider getting it any time now. There's a special vaccine for people that are 65 or over that's called a high-dose vaccine. So studies have shown that these are more effective in preventing flu in older adults. I say that carefully because I'm approaching that
right.
More effective in preventing flu in older adults than the regular vaccine. The high-dose vaccine actually contains a combination of a regular flu vaccine and then an immune stimulator portion of it, which causes a better response to the flu vaccine in older adults. Because we know when we get older, our immune system doesn't work quite as well as when we're younger. So I think that's a really important thing. If you're 65 or over, you should ask for the high-dose flu vaccine because it's more effective in preventing the flu.
Good advice. And Penny Hill, let me ask you, is there any downside about getting the vaccine a bit earlier in the season? Would it has enough, I guess, potency to last the entire flu season if you get it now as opposed to waiting until October 1st or October 15th, whatever it is?
There's a differing of opinion on that, and I did read something that said it should last at least 6 months. I've read in other publications that it should last at least a year, and we get a new flu vaccine each year because it's a little bit different strains that's contained in the flu vaccine. So I always get mine in October, just after the 1st of October, or late September. So I think any time is really good, and it should protect you for the entire flu season.
Okay, very good. My guest this morning, Penny Hill, is here. She is the Infection Control Manager at San Juan Regional Medical Center. And Penny, we just have a couple minutes remaining this morning, so I would love for you to go through how you wash your hands and leave a bathroom for all of us, if you wouldn't mind.
Oh, I'd love to.
Because you've been telling me this for years, and as I said, I finally adopted everything you've told me for the past few years, so I'm doing it.
And you've been so much healthier, right?
Well, I knock on wood, I think so, but definitely this year for sure. But I think it's great advice, and I think a lot of folks can maybe see the benefits. If they couldn't before, we can now for sure with what's going on.
Well, think of it as germs are everywhere, especially in public restrooms.
Yeah.
So on all the handles, the handle going in, the handle leaving, on the faucets. And so you really have to figure out how to get out after you use the restroom, then you clean your hands. So then your hands are clean. If you have paper towels, then use the paper towel to turn off the faucet. You don't want to touch that faucet after you've cleaned your hands. If there's no paper towels, sometimes I use my elbow
Right.
to turn off the faucets because I'm not going to be try not to touch my elbow after that. So then getting out the door is a little bit of a trick. If you can use, a paper towel to do that, that's great. Wait till somebody comes in. Quickly leave the door and stuff. If nobody comes in and you're waiting there and you have to leave,
right.
then you can use maybe the inside of your jacket. That's a little tricky. That is a little tricky. A piece of toilet paper, if you needed to, you could take an extra piece of toilet paper just so that you don't have direct hands-on with the handles. Now, a lot of us these days have alcohol-based hand rub in our cars, right? I do.
Right.
I have some in my purse. I have some in my car. So when I get in there from the grocery store, when I get in there from any public place, then I use the alcohol-based hand rub on my hands as well. So that's another place that's another thing that you could do by getting out of the restroom and then use your alcohol-based hand rub on your hands, and that'll sanitize your hands, clean them as well.
Got it. But just, again, and great advice, and you've been telling this for years and years and years. It hasn't changed, but the conditions have changed, it seems, this year for sure. But that is kind of how germs spread, right? Is how from touching these things, and then if we touch our face, we're at risk. That's really what we're talking about.
That is true. That is true. So we take them from one surface, and germs can live on surfaces. So if the person before you's coughed or sneezed into their hands, and then they touch that doorknob and stuff, then you come right behind them. It can certainly live for hours, if not days, on some surfaces. So you touch that. You don't know that they were just there and put their germs on that, and then you rub your nose because it's itching, or you're rubbing your eyes and stuff, and that's how it spread. Person to person has to get sort of in your body somehow through your eyes or your nose. But if your hands are clean, then that will prevent that from happening.
Right. Good advice. Well, wonderful. Penny Hill, thank you so much for joining us this morning. We certainly appreciate it, and you've been doing this for a long time, but you don't look it. But it's wonderful to see you and have you on the show and to share your advice with us.
Thank you so much. Everyone stay safe. Get your flu shot.
There you go.
Thanks so much, Scott.
Thank you. Take care.
Have a good day.
You too. That's Penny Hill, the Infection Control Manager at Sandra Regional Medical Center, our guest this morning on KSJE. And we're back here in the studios. Scott Micklin along with Megan Cullop. And Penny Hill's she's been great for
many years, but she doesn't look like it.
She doesn't look it.
By the way, listeners, that's what you heard, the guffaw in the background.
That was Megan.
Was definitely
yes.
me. The laugh track.
Yes, thank you. Anyway, great information.
Yes.
Wash your hands. Don't touch your face. It's still the same.
Watch high-touch surfaces.
Exactly. So before we go today, everyone, you had a couple things to share.
I did.
From your massive on-assignment research at the lake that you did.
That's right. Yeah. Just because I was at the lake doesn't mean I can't think thoughts.
Of course not.
Yeah.
Well, no.
So this actually came from one of them comes from my personal algorithm, who shall not be named, but personal research assistant, basically. But anyway.
Your muse?
Yes, the muse. Okay. So MTV Video Music Awards, right? So that's
very popular with the kids these days.
Yeah, well, it's been going on forever. And so actually, I don't even know how popular it still is.
It's short for music television.
MTV is, yeah.
Please continue. Sorry, I will not interrupt you again.
Well, so just the notable thing during COVID-19 is, obviously it was all virtual anyway, but also they included 2 new categories.
Oh.
Because all of these musicians were stepping up and making things during quarantine. So they had best homemade video by a musician and best quarantine collaboration. Can you guess who was the big winner at these awards?
Frank Sinatra.
Yeah, the ghost of Frank Sinatra. They start summoning old ghosts during quarantine.
Sure. It was
Lady
virtual.
Gaga.
Lady Gaga.
Well, yeah, that's a good point, because at Coachella, a few years ago, they had fake...
A little hologram.
It was, yeah.
Yeah, put them on stage.
Weird.
There you go.
So weird.
Yeah. The Lady Gaga, huh? Amazing.
Yeah. Well,
She wasn't still wearing that meat dress, was she?
That
should really be put away.
Yeah, I don't think so. No.
Okay, all right.
And then the other notable thing, did you hear about the CDC invoking the Public Health Act of 1944?
Okay.
And so they're
Because?
staying evictions. So anybody who's under threat of homelessness, they want to stay those evictions so that there isn't more mass congregating at shelters or
Interesting.
mass congregating, too many people moving into one place.
Right. So specifically related to COVID, they are
Yes.
stopping or trying to stop or stay evictions from folks,
Correct.
right?
There's two
To
sort
prevent
of
these problems.
problems with this, possibly. One is the legality of it. They're not quite sure how legal this is for the CDC to just dictate who's paying rent and who's not. And then
Sure.
also that once this moratorium ends, people are still going to be required to pay all of that back. So if you have a moratorium for like 4 months,
Right.
and then you're able to go back to work or whatever, that's it's a huge chunk of
I got to pay 4 months of
cash
rent in one.
in one sitting.
Yeah, that could be difficult. And if you're a landlord, I guess, what does that mean for a landlord?
Exactly.
Is someone going to reimburse or pay the rent instead of the tenant, or
Right.
the
For
landlord
those
just
4
have to eat it
months,
for
or they're
4
going to have to
months?
eat it for, yeah.
Yeah,
So
interesting. But
complex.
yeah,
That happened yesterday.
this week. Yeah,
Yeah.
interesting. Okay. Well, we'll see
there
what
you go.
happens with that. So
Video Music Awards and evictions.
so trendy. There you are.
So trendy.
Very much. Okay. Well,
Cool.
hey, everybody. I think we are about wrapped up with our show, but it was a busy show today.
It was super cool.
Lots of information. We
Lots of
appreciate you
information.
joining us, and please share it, if you think this was helpful. We invite you to share it on your social media networks. And, of course, we're not going to be here on Monday because Megan has another lake to go to. But
Labor Day.
it is Labor Day. But hopefully you can enjoy a day off too, audience. And we'll be back next Thursday.
Yes.
But, of course, we're always posting on ksje.com the daily numbers and the other notable COVID news that comes through. So you can check out things
That's
there
right.
as well. But we will see you next week, everybody. Have a great weekend.
Have a great weekend. Listen to Radio Free Saturday morning.
Oh, yeah. What's our theme this week?
Our theme this week is school and learning and such. So I've been remiss because school's been going on for a few weeks now, but, shout out to schooling. So
And teachers,
check it out.
yeah.
And teachers, yeah.
Right.
Couple
And-
of songs about teachers.
In the dining room table, which is the new classroom. Right. There
It took
go.
a while to click.
Yeah.
Dang.
Well, and you heard the
Losing
other,
my edge.
And the other meme this week was no more snow days.
I know.
No more snow days because with Zoom they can just say, "Oh, guess what? We're not going to send the buses, but just go on Zoom."
Yes.
And still come to school.
I was never really a fan of snow days in the Northeast, but that's
Loved
because I
snow
was
days.
already an adult and
no.
and then you're just like, oh, am I going to have enough food tomorrow? Like, how do I think ahead?
Oh no. When I was a kid, we loved snow days.
Yeah.
It was the best.
That's because you were a child.
I was at one point many years ago.
Same hair.
Same hair, same tie. There you go.
Cool.
All right,
All right,
everyone.
we'll see you guys next week.
Have a great Labor Day, everyone. Stay safe. Bye-bye.